Hello, my name is Naomi. Today I'm going to talk to you about my reflection on the readings of this week. And we're going to start for the first question, what are the main points of the readings. These four readings collectively explore the multifaceted relationship between migration and health, emphasize the structural, theoretical, and empirical perspectives. For example, the article by Piñones and Rivera in 2021 present three major theoretical frameworks: the social determinations of the health, that which link health disparities to economic and social conditions, transnationalism, and which highlights how migrants maintain healthcare practice across borders, and the structural vulnerability, that which examines how systemic inequality shaping health risks for migrants. In the article by Lu and Sarah from 2016, discuss the three case mechanisms explaining migrant health outcomes. First, the healthy migrant effect suggests that those who migrate tend to be healthier than non-migrants. Second, the Salmon bias proposed that unhealthy migrants are more likely to return to their home countries. And skewing healthcare access would also suffer from stress and discrimination and lower social support. And in the article in the Nemer and Resum 2018, this one focuses on the convergence theory, which argues that migrants have initial health advantage fade over time to acculturation and change in lifestyles and exposure to the new health risk. And they also example the Salmon effect, questioning whether it's a real phenomenon or a result of methodological basis. Their work challenges assumptions about immigrant health and highlights the long-term consequences of migration and well-being. The second question was anything unclear or confusing for you and why? Despite my prior knowledge of migration and health, some concepts remain me complex or ambiguous. One area of confusion was the Salmon effect and the whether if this generally influences health data or if it is simply a statistical artifact, while the Lucerne article argued that return to migration and healthy individuals is keys and health statistics. The Nemer Resum article question is validly pointing on the methodological issues and that's understanding the real impact of the return to migration and health statistics so remains a challenge. Another point that required deeper reflection was the convergence theory, the idea that migrants' health advantage disappear with the time due to acculturation is logical, but the extent and speed of this process are not really clear. And I have two questions specifically: that all migrants group experience this decline at the same rate, and what are the specific factors related or slow this process? More empirical evidence is needed to answer these questions. And finally, the role of transnational healthcare practices was intriguing but not fully explored. And while the article by Piñones and Rivera discusses how migrants navigate healthcare across borders, and in that way, I found myself wondering how these practices interact with legal and systemic barriers in host countries. And this complexity makes it difficult to access whether transnationals ultimately benefits or disadvantages to the migrant health. Okay, continue with the third question. Always need to you indeed change how you think. One of the most eye-opening aspects of this reading was the critical re-evaluation of their health and migrant effect. I had previously assumed that migrants were generally healthier than non-migrants, but this article made me question how much is of the due to selection bias versus actual health advantage. One example is the Lucian article that highlighted how while migrants tend to be healthier initially, this doesn't mean that migration itself improves health. Rather, it reflects the characteristics of those who are able to migrate. And in a story article showing my understanding of migrant health decline. I had showed them acculturation as a gradual process, but their work suggests environmental and systemic factors, social labor conditions, and discrimination, like some of the healthcare access, plays much a larger role in accelerating health declarations. This perspective refers to the idea that the health disparities are not just individual, but deeply rooted in structural inequalities. And lastly, the Piñones and Rivera article expanded my perspective on the structural vulnerable, and I had not previously considered how legal statutes, economic policies, and social exclusion systematically place migrants in a health disadvantage. This reservations made me more aware of the need for policies-driven solutions rather than just individual level of intervention. Continue with the first question. Was there anything you would like to explore the further or learn more about and why? I would like to explore how different healthcare systems address migrants' health challenge. While these readings discuss historical frameworks, they provide the limited real-world examples of how countries successfully or unsuccessfully implemented policies to mitigate the health disparities. Case studies on healthcare models in Europe, in USA, and Latin America could offer valuable insights. Additional the physiological impact of migration and health in this area are worth investigating, while the number and recent article mentioned mental health had briefly to long-term stressor of migration, that social discrimination, family separation, and cultural adaptation, and how these topics deserve more attention. Understanding how mental health services can be made more accessible to migrants is something that I think is crucial. And finally, I'm interested in how climate change and forced migration will shape future health trends, given the increasing number of climate refugees. And it's important to examine how environmental displacement creates a new health risk and what strategies can be developed to support affect these populations. I think this is something that needs more attention. And continue with the last question. Give a list of one specific example of an aspect or experience in your personal or professional life related to the main topic. Okay, in my experience, we're in a public health class, and I think in my first grade, we discussed the impact of social determinants of health over vulnerable populations. And one of the topics that caught my attention was how these factors affect internal migrants within Mexico, specifically with analysis of case of agricultural workers who migrate from states in the south of the country, like Oaxaca and Guerrero, to agricultural zones in the north of Mexico. And such one examples in the last video was San Quintín and Manadero. During the discussion, I learned that many of these workers are having good health-related developed chronic illnesses due to extreme working conditions, lack of access to healthcare, and discrimination. And obviously, we can add the insecurity and the problem with the healthcare secures. One of the concepts that made me reflect the most was structural vulnerability, especially with the article The Piñones and Rivera, described as a combination of legal, economic, and social factors that place the migrants at a disadvantage in class. We discussed how this is agricultural workers despite being essential to the farming and economic. Living in this precarious conditions, earning the low wages, working the long hours, and lacking warranted healthcare access. We also examined how, even though public health programs exist, many workers only use to fear the loss in their jobs, lack of documentation, or language barriers, as some only speak their indigenous language. And the discussion made me reflect the importance of the cultural competence in healthcare. And as a student, I wondered how can improve to communication with these patients in this field. And one professor mentioned that some programs have attempted to train the doctors. They use interpreters or more inclusive the communication and strategies, but the lack of resources and trained personnel remains an obstacle. This led me think that as a future healthcare professional, we must make an extra effort to ensure that migrant patients understand these treatments and feel safe and receiving medical care.